Chair. I'm very honored to be here. And my topic today is the robotics for vitreoretinal surgery. And this is my disclosure. And there are several robots for vitreoretinal surgery. And one pioneer from Japan, Dr. Sakai, created the master slave minute miniature robot for vitrectomy. And actually, 2014. And in Europe, one of that famous company, Precise Corporation, has demonstrated robotic safety assistant in vitrectomy. And it is very cool and no remote center of motion, resembling of surgeon's movement, plus removing tremor. And I have idea. So the endoscope assisted vitrectomy is a little bit expanding in Japan. It's effective in case with corneal opacity, small pupil, and hazy anterior inflammation. And at present, surgeons have to hold the endoscope by themselves, which occupied one hand. So I hit the idea. We just proposed a novel robotic endoscope holder to allow surgeons dual hand manipulations. And this is the prototype robot in the stimulated eye. And the surgeon can look at the fundus through both microscope and endoscope. And you can see that the robot can hold the microscope and moves very smoothly. And surgeon can do the surgery by bare hands. And this is the process of development. In 2017, AMET, Japan Agency for Medical Research and Development, I get the grant. And 2019, we get the basic patent and 6 related patents. And we pre-consulted PMDA, Pharmaceutical and Medical Devices Agency in Japan, and got Medical Device Class 1 certification. And 2023, PMDA approved as Medical Device Class 1, and then it was released to market in the spring of 2023. This was assistant robot for vitreoretinal surgery named Okurimo. And Okurimo can hold and maneuvering the endoscope illumination as surgeon's another hand. And all procedures can be controlled by foot controller at the surgeon's well. And rotation, zoom in, zoom out, maneuvering, everything. And strongly recommended to a stopper to prevent too much insertion. In case of emergency, just kick the side wall and immediately evacuate it from the eye. And we can simultaneously use Okurimo endoscope and wide viewing system. Okurimo endoscope is good at observing the peripheral fundus. Wide viewing system is good at observing posterior pole. And so far, we experienced total 9 cases of Primo endoscope. And you can see that 8 cases for local anesthesia and 1 case is general. And for the surgical indications, 4 cases for silicone oil removal and 3 cases for checking peripheral retina, and 1 case is armed valve implantation for via pulse planner. And I pick up 3 cases in this presentation. The first case is a 46-year-old male, acute retinal necrosis, PPV, and 6 months later, I removed the silicone oil. And you can see that clear trochal area and cutter both temporal and nasal side. And I found a small retinal break in the lower parts. So I did fluid gas exchange and do the laser without indentations through endoscope. And the second case is 25-year-old male, sarcoidosis, PVR, and added PPV, and 3 months later, I removed silicone oil. And you can see again that you can find that many tiny particles in the vitreous fluid, and I wash and wash, and then getting clearer in the temporal side and nasal side. And I found the pool of small, minute particles in the temporal side, and I carefully removed by the endoscope without indentation. And the last case is 15-year-old female, JIA uveitis, a secondary glaucoma, and I did armel valve implantation. And you can again see, I put the illumination through the sclera, and we can clearly see the confirm the planned puncture site. And finally, we can confirm the vitreous body and was completely removed from the tube. And this technique was suggested by the Professor Shintaro Nakao, Juntendo University. And all patients have no complication. Without indentation, ocular endoscope is good at observing the peripheral fundus, including retinal break, residual silicone oil, and trocar tube position, etc. It might be exciting to develop new maneuver using Ocrimo in future. And this is our team, Ocrimo and collaborators. And this is my final slide. I'm going to chair the 130th annual meeting of Japanese Ophthalmological Society in the next spring. So please visit Fukuoka in Japan. Thank you for your attention.
So endoscope is with robot is a very nice machine. So can we use? I haven't used that. Always it's on a commercial only in Japan.
Yes, only in Japan. But it was some interference to the microscope and endoscope, but it was adapted. And there is a learning curve, but as you can adapt it, it will be a good tool to assist your vitrectomy, I believe.
Okay, so that the 20 vitrectomy is 25 or any?
It's a 25 gauge
25
needle.
Gauge. Thank you.
Yeah. Can it be used in any which way to help our lives in subretinal injections? I mean, currently
I don't think so. Maybe the next speaker will present the subretinal injection, but it is the robotics for assistant robot, holding endoscope for illumination, some other things, and the surgery, we did the surgery smoothly. It's an assistant robot.
I think thank you very much. That was a great talk.